Hi, greetings everyone. How are you doing? I'm Dr. Kamal Sharma, interventional cardiologist from Ahmedabad. So I'm going to touch upon today about the dissolution technique in Telmisartan formulation. What it means is that you may take a 40 milligram pill of Telmisartan, but actually it may not be as efficacious in your blood to be worth equivalent 40 milligrams. And why is it so? Because the pH that is required for the Telmisartan to get absorbed is a very important determinant how it is going to translate into serum levels. So Telmisartan, which is an anti-hypertensive drug used to treat blood pressure, which is also called a group of angiotensin receptor blocker, and it blocks to the AT1 receptor because of its high affinity. And this leads to inhibition of angiotensin 2, which is a vasoconstrictor on smooth muscles, which lead to, by inhibition, loss of this constriction, leading to reduction in blood pressure. Now, the solubility of Telmisartan in aqueous solution is pH dependent, as I had said in introduction, with maximum solubility being absorbed at high and low pH. So it is seen that different brands may produce different desirable clinical effects because of the same dose if they have different therapeutic response, which are primarily driven by the change in the pH of the GI tract or the soluble environment. So pharmacokinetic properties like extensive first-pass metabolism, low solubility, high permeability, and class 2 drug, BCS class 2 drug presence of food, use of expectorant, diluent, lubricants can all alter what amount of Telmisartan ultimately reaches your blood. So the absolute bioavailability is about 42% in 40 milligram and 57% in 160 milligram of Telmisartan. The solubility in aqueous form is strongly pH dependent. So the maximum solubility is observed between a high and a low pH of 3 to 9. So after ingestion of tablet, it disintegrates, dissolves, and before being absorbed, the rate and extent to which it reaches the circulation is what is determinant of bioavailability. So a small intestine pH, which is between 5.5 to 6.8, if the dissolution is not proper and solubility is not very good, it results in low bioavailability, and it's an important rate limiting step for the drug absorption. So if the drug does not dissolve readily and does not penetrate the epithelial membrane, time of the absorption may be insufficient, and hence the level of drugs reached or the bioavailability of the molecule for that pill will be low. So with any oral preparation, drug dissolution profiles may be distinct due to differences how they are manufactured. So as mentioned earlier, because of variable therapeutic response with the various brands, the Telmisartan with unique pharmacoproperties, comparison of dissolution profile and other parameters of generic Telmisartan brands as compared to the innovator is something that needs to be checked and required and evaluated. Because various methods that are used by manufacturers to overcome this low bioavailability and improve dissolution of a poorly water-soluble drug is by formulation of what is called as solid dispersion with hydrophilic polymer polyvinyl. So other diverse carriers and use of alkalizers are also being used. Sodium hydroxide is considered as a strong alkalizer, and it provides maximum solubility to Telmisartan. So some of the generics and innovator brands, they contain sodium hydroxide, NaOH, and it creates a microenvironment of pH around Telmisartan granule, which increases the solubility into the intestinal fluid. So this unique technology is used by companies where micronized Telmisartan granule mixed with suitable alkalizer, which is usually sodium hydroxide, as an open label 2-arm randomized parallel study to assess the bioavailability of Telmisartan in 18 healthy male volunteers. They found out that the Telmisartan peak concentration is achieved within 30 minutes of oral and with a Tmax of 1 hour. So this dissolution medium selected is pH of 7.4 phosphate buffer, which is media specified for Telmisartan as per FDA OGD guidelines, where 900 ml of 75 RPM maintained at 37 degrees Celsius plus minus half degree. That is mandatory for it to be having the same pharmacokinetic properties. So the USP requires not less than 75% of the label amount dissolved within 30 minutes, and the dissolution of more than 80% of drug should be released within 1 hour following the pharmacopoeial specification. So compared with Micardis, which is the original brand, which has got 94.68%, Telista has shown 96.68% of drug release. So features of Telmisartan dissolution profile shows NaOH strong base used to dissolve as drug insoluble in strong base. Alkalizer used for improving dissolution profile in Telmisartan tablet as per the innovator brand Telmisartan. Dissolution medium selected in pH 7.5 phosphate buffer, which is a media specified for Telmisartan tablet as per FDA OGD guideline. USP requires not less than 75% of the labeled amount dissolved within 30 minutes. pH 7.5 is recommended buffer pH in the United States Pharmacopoeia, and development of dissolution method was validated according to ICH guidelines because providing the method in experimentally sound, yielding precise, accurate, and repeatable results is an important aspect in management of hypertension. Thank you very much for patient hearing. Looking forward to get connected with you again in future. Take care. Bye-bye.